Welcome to selfdiscoverywisdom.com, formerly known as Self-Discovery Media. On these podcasts, you're going to hear people who speak from the heart. They've taken the journey in life. Many things have happened to them, but they've changed it to happening for them. And in their strength, their courage, they've discovered their abilities and their wisdom, and they are now sharing it here with you. Do enjoy each show. We bring it to you with love and knowing that it's going to help you on your journey of life. Good morning, good afternoon, and good evening, everybody. Welcome back to another show of Your Health is Your Choice right here on selfdiscoverywisdom.com. I'm your host, Sarah Troy, my wonderful repeat guest, also the author in I've Forgotten Children series, so we're delighted to have her here, is Mikki Stone. We're going to be talking about a very unusual subject today. Unusual because most people don't know about it. Ehlers-Danlos Syndrome, known as EDS. What is that? Is that a form of fibromyalgia? Is it a form of arthritis? Is it a form of this or a form of that? Well, a lot of people just simply don't know. I've never heard of it. Well, unfortunately, Mikki has it. So she's going to be describing with us today how she lives with it, what it is. I'm going to read a little bit about the explanation of what it is here. She said she would like to shed light on the topic, often invisible chronic pain conditions such as hypermobility type Ehlers-Danlos syndrome. It's said to be a rare condition. She calls that bull's bit on that. It's rarely diagnosed. That's why it's a rare condition, and it's another thing to altogether. EDS is a hereditary condition that affects the skin, mobility of the joints due to abnormal collagen synthesis, an important component of connective tissue. The latter is abundant in the skin, the joints, and the vessels to which it gives strength and elasticity. Although it develops in childhood, the diagnosis is only reached in later years. The condition takes very many different forms and can be vary in severity, and in the clinical manifestations very widely, sorry. EDS syndrome diagnosis based on physical examination through observation of how a patient moves and the doctor analysis of his or her medical history, usually a rheumatologist. I got my tongue around things today. A psychotherapist establishes the diagnosis rather than a general medical practitioner because most of them don't know what it is. And, many years ago, fibromyalgia was like this. People didn't know what it is because fibromyalgia covers an umbrella of so many things that fits under that umbrella that was also one of those things that people couldn't work out. And the reason they couldn't work it out, although numerous amount of people had it, because not enough doctors were talking with each other on it. So rare condition, possibly, but at the same time, as you say, rarely diagnosed. And so therefore, how do you know if you have it or not? So we're going to be talking about that today, the symptoms. I have put a graphic in her show page that shows a few things, like you could bend your hand all the way back, or you could pick your skin right up like this, and many other things. And it's kind of quite scary. But I think if you did have it, you would know it even if you didn't know what it was. Right, Vicky?
Well, you know you have something. The
Mm-hmm.
problem is that the medical industry tends to gaslight people with EDS. It's all in your head, particularly if you're a woman, of course. And, that they will look at the individual symptoms and attribute that to something sort of benign, or they'll just shrug and say, I don't know,
Mm-hmm.
but and often it's misdiagnosed as fibromyalgia these days,
Yes, yes.
funnily enough, because there's pain and because it's not sort of easy to see. You can
Mm-hmm.
look at a person with EDS and say, well, they look fine to me, which is something, I know a number of people who have EDS to the point that they sometimes need a wheelchair, for
Mm.
example. Not all the time, but sometimes. It depends on the day. It depends on how long they're up and what they're doing. And I know of people who have been yelled at in places like Walmart for using a scooter. Like, there's nothing wrong with you. What are you doing? And people are very judgmental
God,
and they have
yes.
no idea what
No.
they're looking at. And just for the visual there, when you were talking about the different things that people can do, there's this thing called the Ehlers-Danlos gang sign, if you will, and it's this. You can bend
Bend your
like that.
thumb right down to your inner arm. Right.
Yeah. Not everybody can do that and still
Nope.
have EDS,
Yeah.
but it's one of those signs that a lot of people will say, "Oh yeah, you do this too."
Hmm.
And then you sort of start to investigate the other aspects of what you're dealing with. And some of them are kind of surprising until you realize how extensive connective tissue is in your body and how that can affect everything from your blood pressure
Hmm.
to your teeth, how your gums hold on to your teeth. And a lot of people with EDS will be given a very hard time by their dentist, told, you're not looking after your teeth. Look at this. You obviously aren't flossing, and lots of judgment. And you could be flossing 3 times a day. It doesn't matter. If your
Yeah.
gums say no, they're saying no, you
Yeah.
know?
Yes. Yeah. I mean, I've had fibromyalgia for 26 years, and in the beginning, yes, it was in your head, or it's just this, it's just that, and no, you've got this, but you've also got that, and they just kind of look at you as the more as they pile on what you've got, which is the umbrella of fibromyalgia. They look at you as if you're a hypochondriac, that you've chosen this, right? No, I
Right.
didn't choose this, thank you. How do I get rid of it? Which, of course, we've since found out you can't get rid of, you can only manage. And as far as the teeth are concerned, we get screaming teeth. Yes, we get the gums. The gums don't bleed all the time. Sometimes they do, sometimes they don't. But I get screaming teeth because, fibromyalgia is hypersensitivity. All the nerve endings are screaming. And my teeth will scream. And it's really hard to kind of explain that to things. But imagine all of your teeth at the same time, kind of all having a toothache, screaming. And
Oh, I
yeah,
know.
I have to get scotch and rinse my mouth with scotch to calm the nerves down. That's not too bad. But it's like it's so hard to explain to people. My teeth are screaming. What are you talking about?
Well, I literally, on a day where there's a flare up, and
Mm,
that can be caused by stress, it can be caused by having eaten the wrong thing,
yes.
and you don't necessarily know what that is until you eat it.
Yeah.
But when you wake up in the morning and everything you have hurts. And I can say literally, my hair hurts.
Hmm.
That's the point it can get to. And on those days, it's very difficult to know what to do with yourself because lying down hurts,
Yeah.
but getting up and walking, something's likely to slip out of place because something else with the hypermobile type of Ehlers-Danlos is you have a lot of hyperflexibility, which sounds great, but the problem is you can get into places you can't get out of again.
Ah,
I
right.
used to do yoga a lot, and I would see my chiropractor. This is before I was diagnosed. I'd see the chiropractor 2, 3 times a week. And he finally said, could you not just stop doing yoga? I don't know why, but you can't get back from the positions you get into.
Ah.
And things
Mm,
kept dislocating. And I have ended up with both shoulders operated on over the years because they the tendons tear and they just, they're too lax. They can't hold. And so, doing strength training, sure. I used to do boxing. I'm a fitness trainer. I have been a fitness trainer. So I know how to strengthen, but it doesn't matter really how much you strengthen when the connection between the bone and the muscle is faulty. And
right.
it's like your body has a faulty recipe. So you can take in collagen and you can take in protein, and absolutely I recommend that. But your body will take it, break it down as it normally does in order to use it in the body. And then when it puts it back together again in the format that you're supposed to use it in, it's not quite right.
Right
And
recipe. Mm,
it
yeah.
doesn't hold you. And so other muscles in the body are recruited to do the job instead. And that's when you get injuries, things slipping out of place, and all sorts. My eldest son, EDS shows up for him very much in his shoulders. And he's very, very fit, very healthy. He eats wonderfully. He works out all the time. And he was rock climbing. And he
Mm,
did one of those overhead, overhang things. And just as he was kind of reaching backwards, both of his shoulders dislocated at the same time. And he went
ouch.
down like a sack of rocks.
All right. I hope he was tied to something.
I don't think it particularly was at
Oh
that point,
God.
but
Oh, God.
he knows differently now,
Right, exactly.
and he's
Exactly.
done all the things he's supposed to do.
Yeah,
It's just that the shoulders aren't really paying attention to that. They don't care. If they're
yeah.
going to give it up, they give it up.
That's completely opposite to fibro, where everything tenses up. I live in a state of everything contracted all the time. The back is contracted, body feels like your cardboard. Everything takes extra movement because everything is heavy and everything is stiff and everything is sore. So absolutely opposite to any fluidity. And we don't put things out like the way you do, but it just feels like we do because like everything is so hard to move. And
Right.
people don't understand. You're acting like an old lady. And it's like, well, I feel like one, I'm not
Right.
there yet, but I feel like one because the body is so utterly stiff. So it's from one extreme to the other. You're too flippity floppity and we're too stiff. We need a happy
Well,
medium there.
Well, now with somebody with EDS, when you've had it for a while and you get repeated injuries,
Mm,
it can confuse the doctors when they
yes.
look at you because the part that's been repeatedly injured can become stiff because there's just so much scar tissue.
Ah.
And
Hmm.
so some parts of you will be overly flexible and some bits will be stuck because of the scar tissue. And so everybody presents a little bit differently. But there are
And that's
also,
probably where the kind of the ADS and fibro comes in, where they probably think now it's fibro and not the
right.
ADS, right? Mm,
And they just don't know what to do with it. I mean,
right.
it's a broad spectrum of problems. A lot of people will have orthostatic hypertension, so they stand up and their blood pressure drops. Others, like myself, will have naturally high blood pressure, and it doesn't matter what you do, my blood pressure isn't coming down. It's been like that since I was in my 20s. And my weight isn't the important part. My salt intake isn't the
Mm,
important part. None of that matters. It's the connective tissue in the blood vessels and the fact that they don't relax enough
ah.
to have the blood pressure be more regular. So it's a thing that I have, and other people will have orthostatic tachycardia. So they're fine doing their thing, and then suddenly the heart flips into a very rapid rhythm, and they'll need medication or need to lie down, sit down before they pass out. So there's all kinds of things. You can be walking along merrily doing your thing and suddenly you're not okay, and
Hmm.
there's no clue really as to
No.
what's about to happen. It just does.
No indication whatsoever and no
No.
reason sometimes either, you know.
Right. Well, nothing you can point to for
Right,
sure.
exactly. Exactly. I find with the fibro that, I can have exactly the same sleep, do exactly the same thing, but one day is worse than another. But why is it worse today? I'm in a good mood. Everything is feeling great. I'm eating healthily. I had a good sleep. Why today am I a cardboard? And you just don't know
Right.
why, right? And it's this, and of course, I'm sure you get when people hear this and they maybe get a smidgen of what you're talking about. Out comes all the, have you tried this? And have you done this? And you should do that.
I have a lot of people telling me how to exercise.
Yeah,
I get that a great deal. And the thing is, I've been a fitness professional since 2008. I have 3 certifications with American Council on Exercise that are all still up to date. I'm a former nurse. I've done a lot of
yes,
anatomy and physiology study. Plus, when you have a condition like this, you have to do the research because the doctors
yeah,
don't know what they're looking at.
no,
And my doctor always asks me when I go in there, what have you got for me today? What have you found out? And
right.
I give her articles and stuff because she doesn't know. She knows enough to know it exists, but she has no idea how it works.
It's a complete
So
study on its own, isn't it?
it
It's,
is.
yeah,
And it's not particularly well funded because
mm,
it's not sexy.
right.
Everybody can get behind something like breast cancer
Yeah.
or childhood cancer, right? Everybody can sort of wrap their head around that. But EDS is something that's kind of a moving target, and a lot of people look well. I mean, I look fine. You wouldn't think I had anything wrong until I'm walking and one of my hips goes out of place.
Yes.
And or something else will happen, and then it's like, oh, okay, got a problem.
Yeah.
There was one time I was combing my hair and I had my arm up, and a sneeze sort of came on by surprise. I sneezed, and the next thing was I had to be at the chiropractor. I'd put a couple of vertebrae and a rib out of place
Oh my
by
God.
sneezing.
Yes.
And he said to me at the time, the most dangerous things that you can do are sleep and sneeze, because things go out of place when you sleep.
Right.
You If you get to a deep sleep and you're nice and relaxed, the bones and the joints start to kind of settle, and they settle more than they would in somebody without EDS. And so when you wake up and everything kind of snaps to attention, some things are possibly going to be out of place. And then you have a problem today, and you have no idea till you wake
It
up.
is so completely opposite to fibro because we need the deep sleep to cause the body to relax. That's when it starts to unwind and untension. But we don't get the deep sleep because we're most of the time in pain, right?
Right. And with EDS, you've either got the pain keeping you awake, in which case you haven't had the quality sleep, but at
Mm,
least nothing's gone out of place,
right.
or you sleep and then you wake up with something out of place.
Yes.
So it's devil you do, devil you don't. It's just one of those things that can cause big issues. And if you have a big stressful event in life, like a job loss or moving, divorce, anything like that,
Life
that
in general.
that stress kind of
Yes.
up levels all the symptoms that you have. It
Yeah.
sort of increases them. And it's not a surprise, really, when you think of all the hormones that stress produces in the
Hmm.
body. It's going to have an adverse effect. So, that can come in as well. And people just, they don't get it. They look at you and say, "What on earth? Just pull it together." And I'm like,
I know.
"Hey, I'm trying."
Yes, yes. I was fortunate about 10 years in from my diagnosis. I went to a specialist who had spent 20 years at that point because his wife had it, and he really studied what it is that she had. And at that point, he said, as I know it now, fibromyalgia has 31 points. I ticked off 29 of those. Since then, and this is when was the last time I saw him, 2010 or whatever, it is now increased even more. That there is even a higher number then as the things that they find, with it. And again, it's been marked up to a disease, incurable because you could cure one thing, but then what about the other? There's too many points under the umbrella. So all it is manageable. And as you said, we look fine.
Mhm.
We look fine. Nobody think, what's wrong with you? Why are you walking? My kids would, Mom, you just need to do this. If you did yoga, if you did that. Now someone said to my son, I just grabbed his hands in the middle of him trying to tell me what I needed to do. And I said, please stop. Because every time you say something like this, I know it comes out of love, but you make me feel broken.
Right.
Just simply hug me and love me and support me because believe me, I'm doing all I can. And it took a
Yeah.
weight off his shoulders of thinking that he needed to fix mum, right? Instead, just support mum. And really, when you have anything like you have, like I have, really what we're wanting is just people to have an understanding that we live with challenges every single day that you can't comprehend.
Mhm. And I do find when I meet another zebra, we are called zebras, this group of EDS people, because there's a saying in the medical community when someone's a medical student and they're working out what a diagnosis is, the saying is, when you hear hoofbeats, think horses, not zebras. In other words, look for the common thing,
Right.
not the unusual.
Mm,
So people with EDS became known as zebras because we're not what you're looking for.
right, exactly.
Um, and when I find another zebra, it's it's a bit like finding another Brit in a
Yeah,
completely different country. You're sort of
yes,
all excited and
yes.
like, oh wow,
Familiarity, right?
yeah,
Understandable, like you get each other,
yeah.
yeah.
And it's like, oh, what do you have going on?
Yeah.
And we do this little comparison dance of what's happening. But there are different types of EDS,
Mm,
and most of them can be diagnosed with genetic testing. The hypermobile type cannot. That
mm.
one is more of a clinical diagnosis going by symptoms. They haven't
Can
found the
one
disease
lead
for
into
that
the
yet,
other?
but they will. No, they tend to be different. For example, the vascular type of EDS, the average lifespan for somebody with that is 42.
Mm,
And the blood vessels kind of give it up, the
mm.
aortic aneurysms and things like that. So their EDS problems are located in blood vessels more so than in joints.
Would
And
those be the people that would have like heart attacks and things?
they would have all kinds of
Mm,
cardiovascular problems. And lifespan tends to be a lot shorter because of that. And, and they'll also have more mobility problems again because of that. But that one can be genetically tested for. And some people will have two or three types of EDS going on
mm,
at the same time. And, the number of medications they're on for all of these things is crazy.
yeah.
But you look at that person and it's still, well, yes, I see you're in a wheelchair, but I don't see why,
Mm,
And unless you've got like a broken leg or something, people don't think that you ought to be doing what you're doing or
yes,
not doing, you
exactly.
know? And it's such a challenge, but public places, like I mentioned, Walmart before, or
Mm.
anywhere where they have those electric scooters, if you see somebody in one of those and they don't look like they need it, you might be looking at a zebra,
Right. Or a fibro.
right?
Yeah.
But chances are they wouldn't be sitting in that thing if they didn't have to.
No, I mean, who wants to? Because who wants that, judgment, even when they go, I really don't care. It's got, nothing to do with me. At the same time, those glares and those stares can be very discomforting. And, people, oh, just lazy. Um,
Right.
right? Oh, look so young. Why can't you get out and walk? There are people in need of that. I qualify to get a disability tag for my car. And I haven't because I thought, no, I'll park as near as I can and I'm going to walk it for as long as I can. And I may get to a stage where I need to have that disability because I can't park too far away from where I'm going. And I'll get it then. But it's like kind of, I call myself differently abled,
Mhm.
right? I'm just differently abled. And I've learned to have, after 26 years or 27 now, I think it is, partnership with what I have. We have an agreement. I don't push myself too far, don't do too much, and then you won't come and visit and hit me over the head, right? And if I allow you to tap me on the shoulder sometimes, say, you need some rest, I'll pay attention, right? And we've learned to live with each other, to partner with each other, because the moment you look at anything that you have, anything that you have is challenging, an ongoing challenge, not curable challenge, you can't make an enemy out of it, can you? Because that's just going to build up resentment and make things worse.
I honestly do my best not to think about it overly much. I mean,
Right.
it makes its presence felt, and
Yes.
then I will acknowledge that, oh, okay, we're doing that today, are we?
Yeah,
Fine.
yeah,
And
exactly.
I'll
Your
work
voice.
around that.
Yeah.
And I'll work around that. And if it's I find vacuum cleaning will mess up my hips, for
Yes.
example. Walking the dogs, I'm fine so long as they go straight. Second they pull off, something's gonna go. Excuse me. So, there are different challenges that come up, and I'm always a sort of sleuth, right? I'd love to
Mm,
follow the threads of things, so I just use that with the EDS as well. And I belong to a group on Facebook it's a huge group of people with EDS, and sometimes something weird will happen, and I'll just pop in there and say, "Hey, anybody else with this?" And you get a surprising number of responses very, very quickly. So we can figure out if that's another thing under the umbrella or if that's just a personal quirk.
right.
And it's very often something that everybody has. And depending on how long you've been diagnosed as to how much of that you know,
Mm,
but it's fascinating to see the different things that come up. Like it really is. I have to wear sunglasses when I'm outside, for example, because my eyes let in too much light
mm,
and I'll damage them if I don't have sunglasses on. I don't view that as a disability, but it's something I have to remember.
right.
Um, and trying to get your kids to follow sensible rules when they don't feel like they have a problem until, shoulders dislocate or something. Um,
Yeah.
it can be difficult because, again, they look fine, they feel fine, but there's
Yes.
this thing where the shoulder's just going to pop out. My
And
eldest.
you don't know if it's the shoulders or if it's the hip, you don't know, but something at some point will pop out.
Yeah, and then my eldest, he can dislocate his shoulders. Just he just does that, and off it goes. It's really, it's
Can you
far
put
too
it back
easy.
in?
He can put it back in, but if you keep doing that, you end up with wear, tear, and surgery.
Yes. Yes,
That's
exactly.
like I had both of my shoulders operated on.
Right.
And the right shoulder was in July of 21, and I was one tendon shy of a shoulder replacement for that.
Wow.
There was a lot of damage. I had like 6 incisions to get that shoulder fixed up.
Wow.
And I hadn't done anything that would warrant that if I didn't have EDS.
Yes, exactly.
You know,
And
somebody else
there's
could do things.
on AGT, America's Got Talent this year, they had a group of people that came on that can dislocate themselves and turn their
Yes,
body.
I
And I
saw
look
that.
at that and I thought, A, how can they do that? And B, should they? If you're doing it over and over again for performance, is there not
Uh-huh.
some damage in there that you're doing?
Sure. And I would look at that and say EDS.
Right.
I would put money on it. And when you look at contortionists, for
Mm,
example, China will often have a family of contortionists touring. And well, EDS is genetic, it gets passed on. So what you have is a bunch of people who are really, really flexible, and they're just like, oh, hey, watch this, I can do this. And boy, can they. But
yeah.
at some point, they are going to have some very serious problems
Yes.
with
Just
what they're
because you
doing.
can doesn't mean you should.
And in this case, it means really, really,
Yeah.
don't. It's yes, it's cool because nobody else can do it, but at the
Right.
same time, you have a big chunk of your life to pay the price for that. So
Yes.
you might want to not.
Exactly. Yeah. I mean, this is the thing with life, isn't it? Is that, you know, I've done numerous shows on people with fibromyalgia because when I, you know, did a show myself on it, again, out of the woodwork. I have it too. I have it too. And by doing these shows where everybody's sharing their own journey with it, because everybody has their own journey with it. But one of the common denominators we have is fatigue. It's like, I put the
Oh
analogy
yeah,
to a cell phone where it doesn't matter how much you charge your battery, it never fully charges and it depletes very quickly. And so we're never fully charged and we exhaust very quickly. Does something like that happen in EDS?
absolutely. Yes, 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 yes.
That I
There
think is
is
the biggest pain. I can live with the other pain, it's the fatigue.
yeah, the fatigue is pretty much a constant.
Yes.
And like sometimes you'll see these questionnaires about sleep, how often do you wake up feeling refreshed? And I would like to know what that feels like, so I have a
Yes.
reference point,
Yes, I
because I
know.
don't think I have ever woken up refreshed. I
Right.
don't think that ever happens for me.
Yeah.
And I'd love for it, but it's not a thing. I don't get that. And you can be going on through the day, and then it's just like, every
And when it's out, the battery's out, it's out. You've come to a full stop.
when it's done, it's done.
Yeah.
And funnily enough, a thing that comes to mind is when I was pregnant with my first child. Now, I did not know I had EDS at this point. I had no idea, never heard of it. But when I was pregnant with him, I would get to a certain part of the day and my energy would literally disappear completely.
Yeah.
And one day I was swimming in a pool and that happened and I nearly drowned. Like I could barely get out of the pool because the fatigue hit
Hmm.
me so hard.
Hmm.
I could hardly move my limbs to get to the side of the pool. It was
Wow.
incredible.
Yeah.
And every day I would have to just close my office door. I ran a medical clinic. So ironically, I would close the office door and put a sign up there, come back in half an hour sort of thing. And I would literally have to lie down and sleep because I had nothing left
No.
to give, nothing.
And people
And,
don't get that, do they? Well,
and
you've only
if it's
worked
not
four
there, it's not
hours, or
there.
you've only done this or that. I mean, what have you done to make yourself so tired? Just breathe, just be alive. That's it. And they're just, unless they've got it, they have no understanding of how
Oh,
fatigue can just flatten you.
that feeling when it just literally,
Hmm.
boom, it's
Yeah,
gone is staggering. I mean, I will never forget that time in the pool. I nearly drowned.
right.
And,
Exactly.
if I hadn't done it myself, if I hadn't experienced that, I would probably find that tough to believe.
Yeah,
But
exactly.
but it was a
Yeah,
heck of a thing.
You have written a chapter for our Forgotten Children series, which is hopefully going to be up by the end of the year, collaborative contributions for people, and you've done it on behavior with children. But there was
Yeah.
one part you wrote there, which I kind of, after listening to the waking up and feeling tired, is that your son hated wake up in the morning. This is
Yes.
before EDS was known. And of course, you woke him up with his pet rats, which kind of set him up for the joyful thing. So he got up, to feed them and this and that. But could it be that that was an EDS thing and you didn't know?
Oh, very easily.
Yeah.
Yes, could be. Because this child, well, when he was a child, he literally could sleep standing up. I saw him, I went to pick him up from school once when he was still quite young, and he was standing by a tree, and he was kind of on his own. And I was talking to the teacher and looking at him, and the teacher said something about, oh, I wonder what he's watching. And I said, I don't think he's looking at anything, he's asleep. And she didn't believe me. So we walked over and he kind of got his arm hooked through the branch and he was fast asleep standing up. He was out cold. And she just kind of stared at him with wide eyes and said, well, how does he do that? And I didn't have an answer, but I could tell her that he did things like that all the time. He would fall asleep in the strangest places and sleep solidly. So maybe that is an EDS thing,
Yeah.
but
Yeah.
because I didn't know anybody
I'm
else that did
envious
that.
of that. I'd like to know what sleeping solidly is.
Oh boy, I tell you, we used to fly a lot because we've lived in a lot of different countries, and getting onto a long haul flight, my two boys would sit down and the youngest would say, right, wake me up for breakfast. I'm going to sleep. And he'd put his head down and he's gone. And my eldest is there getting ready to strangle him because because he can't sleep just like me. So the two
Yes.
of us would be wide
Right.
awake and my youngest and his dad would be fast asleep.
Yeah.
So,
No, most envious. I'm taking a flight later this in September. And because my daughter insisted I go into Gat, my sister insisted I went into Gatwick. Later, then told me, no, you could have gone into Heathrow. After I booked, I'm going by Iceland. So there were a lot of flights that were one or two stops. But the beauty of this is I can actually get out and walk around. And although it takes longer, it's actually better suited to me because it breaks the trip in half. And I have an hour or so in between where I can just walk around and just kind of get the body going. Because for me, sitting that length of time, seize up. It's like
mm,
you need the oil. I feel like Tin Man. I need the oil can to loosen me up, and as I walk around.
yeah,
So
yeah.
yeah, I watch these people go to sleep, and it's like, God, I wish, but no, no such luxury. But I think, one of the things is that things with EDS and fibromyalgia is becoming something a little more talked about. There's fibromyalgia platforms now where people share their struggles or share, for me, I have a show to share for them, for whatever they're dealing with. We've talked about that. Um, it's good that we have those platforms because otherwise we feel so isolated. And when
Mm,
you're isolated, you begin to feel there's something wrong with me. And when you know there's other people, sadly, there's other people out there with it, but that companionship of understanding each other, where you can actually talk about the struggles, and nobody is going to go, "Oh, suck it up," right? And
right.
it makes you just feel more of a whole as a person because nobody's picking you out saying you're faking that or you're just doing it for sympathy. They resonate with you. And that's
Yes.
the reason why we're not doing it as a pity party with each other. It's a safe place to where you can talk about that was a bad day. And then somebody goes, I get you, and just send out a hug. And it's just that acknowledgement where other people just look at you and go, well, what's wrong with you?
There's also the support of having people at different stages of their journey
Yeah.
where some will have found decent medical help.
Yes.
Everybody wants to know where that is,
Yes. You found a
because
doctor that understands. Who is he?
right.
Yeah.
And it's quite rare to come across,
Yes.
but people put other people in touch with,
Yes.
you get your network going. It's kind of like a mycelium. And if you have uh, a fungus pop up that happens to be a good doctor, then, everybody's going to
Yes.
head over that way if they can, or at least they're going to look for articles by that person or something, because you're always looking for sort of medical advice that comes from somebody who knows what they're talking about. So there's like one book called Disjointed, and it's written, the chapters, just like the Forgotten Children book, are all written by
Mm.
different people.
Mm-hmm.
There's 21 doctors who have written something in that about EDS. And it's not a cheap book, but it's a fabulous resource for people with EDS to be able to sort of look up things and say, well, is that part of what I've got? What do I need to do with that? Or how do I respond? How do I lessen it? What do I need to do next? And
Even just simply understanding what's happening to you,
right.
right?
And
You're not
sometimes
doing anything wrong. It just is.
it can make a big difference. For example, someone with a hernia going to get a repair is going to need different sutures to somebody without EDS because regular sutures won't hold.
Oh,
And so they
why is
need
that?
something different. Again, it's the connective tissue that simply gives way. So they have to have a different type, and there needs to be a different amount of stitches and so on and so forth. If you don't know that, you're going to end up with repeated hernias in the same place, wondering why. Right. So the community of people with similar conditions is crucial for passing that kind of information around. And when somebody says, oh, hey, this thing just happened to me, what do I do? People who have already experienced it can jump in and say, well, this is what I did. And those who haven't experienced it can look and say, oh, now what have I got coming?
Yeah.
But you can sort of keep up to date with all the possibilities that you may or may not face. I don't consider myself to be particularly badly off at all. I'm mobile. I don't need a wheelchair. um, I have really rough days, and I've got certain things like permanent high blood pressure. That there are issues, but I know people who have a lot more going on than I do. And I know that what I have gives me some tough days. So for them, I just can't imagine every day is like that.
Yeah.
That's just wow. That is a lot.
I mean, I put out information all the time, even on your show posting. I've put some pictures there for people to actually have a graphic. And actually, a long time ago, before I actually understood what EDS was, it was joint hypermobility, EDS, fibromyalgia, and myofascial pain. Myofascial pain is the fiber optics that are in your skin, and if they're damaged, then the energy chi is not running through your body, and that causes things to seize up, which I have as well. Never understood what that was. And, I have a little bit on the EDS here. I'm going to add your show to it on this page so people could go back and understand it a little bit more. But, for me is that it's share, share, share. Because through the
Yeah.
sharing, it helps people, whether they have it or not, or whether they may know somebody who has it. And it is like nobody wants a pity party. We just want you to understand we have limitations. There's no limitations. Don't place limitations on you. No, we have limitations. There are things we can and cannot do. That doesn't lessen us. That doesn't make us any less of who we are. It's just our boundaries of what we can or cannot do because the price is too high to pay if we do.
And I do find that when somebody has a challenge, a health challenge, very often that person will find ways to overcome in a pretty spectacular way differently. And
Yes.
what I'm thinking of particularly now is a chap by the name of Milton Erickson, who anybody who's into NLP will know of him because he basically is where NLP came from. And he's also done trance work, which is like a very deep inner self-hypnosis work. But his ability to communicate and his ability to understand what people were not saying
Yeah.
was phenomenal and unparalleled. And he learned all of that because he'd had polio. He was in a great deal of pain and he was in a wheelchair. He couldn't move. So he worked on himself
Yes.
and improved himself as much as he was able to do, and far more than anybody expected. But he also developed this phenomenal ability, this just incredible thing that has altered so many people's lives. And he would not have done that if he hadn't had the challenge. So, it's a bit much to say, well, your challenge is a gift, but you can certainly find gold in
Yes.
it.
Yes. And I think
you
that
can
goes for
find that.
anything, right? Anything in life, anything that we go through in life isn't there to punish us. It's there for us to learn from,
Yeah,
right?
you can choose how you look at it and be sort of morose and life sucks.
Victimized. Yeah.
Life sucks and isn't this terrible?
Yeah.
And at the end of the day, you got nowhere
Right.
and nothing improved. Or you
Nothing
can
improved.
look
Got
and say,
worse.
well, that's interesting. What am I going to do with this? And learn something and maybe help somebody else to know a thing. There's a
Exactly.
few people that I have seen. I see them doing something, and I'll kind of go over to them and ask a couple of questions and then say, you might want to read this book, Disjointed, and see if you recognize yourself in there.
Yeah.
Or I'll send them to the group of people with EDS. Have a look and see if this is you. You might want to check this out with your doctor. And a lot of times people will say, well, I've never heard of this. What is this? But
Right.
yes, I have all these problems. And they'll start listing off this long list of things. There's a laundry list.
Right.
And the more they add, the more I'm sort of, yeah, I
Hmm.
think you need to investigate
Right.
this.
Yeah.
It could be you, and I'm not
Exactly.
going to diagnose a person, but I can recognize certain
Well,
things.
you identify, and through that identification, you're giving them a path to go on to verify.
Right. And when I had my left shoulder operated on, that was in the early 2000s. And when I was going to physio, they took a medical history. And the woman taking the medical history, I remember this so well. She looked at it and she said, "This is ridiculous. You are far too young to have all of this. What is going on with you? There's something else." And then she said, "I think I need a doctor. I know a doctor you need to go see." And the doctor that she sent me to, his focus was all about leaky gut
Hmm.
and the effects of leaky gut. And there is a lot of correlation,
Yeah.
yeah, but I don't think causation.
Right.
However, he had no idea of EDS, but this physio was, she looked at it and said, "No, no, 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 this is not right. You should not have all these things. There's something going on that's causing this. Like, what is it?" And she was the first person to actually look at my laundry list
Hmm.
and take it seriously and
Yes.
see that it
You say,
actually
like,
was
this is
a
not
hole.
normal here. This is not normal. Right.
Right,
Yeah, I remember being sent to a pain clinic where they would do either acupuncture or injections into certain sites. And it didn't work on me. And, they said, "But why isn't it working on you?" And I said, "Because you are treating people with specific injuries, knee injury, shoulder injury. You're injecting those areas. And yes, when you inject those areas, that's great. But what all you're doing now is emphasizing the other area. You've got to understand what that knee pain is, what that hip pain is, what that back pain is my body pain all day long."
right,
Right. So you can stick all the needles in you and then it may work. Me. But just hitting one area only then emphasizes the pain on the other side because it's out of balance. If you're going to
right.
do one side of the neck, you need to do both sides of the neck because it's not just one area. I couldn't get them to understand that.
Yeah, because it's a lot, and it means that everything they've learned is
Yes.
incorrect in your
Yes.
case.
I
And
mean,
a
it
lot of
means they
doctors
don't
don't like that.
understand, they understand injury, but they don't understand things like fibro or EDS. They don't understand the complexities of that. And let's face it, there are complexities. And, and each patient, you may have one patient you've treated this way, but the next patient comes in with a different variation of it. Now you've got to learn how to treat them because it's not the same kind of treatment.
Right. And actually, another thing I'd like to mention about EDS while it pops into my mind is, as I've mentioned, it's genetic. And even though they haven't quite isolated the gene for hypermobility yet, I feel sure they will. It marches along the same path as the genes for autism.
Oh.
And so, what you will very often find is a child with autism will be remarkably bendy. They will
Mm.
have a great deal of movement and hypermobility. And particularly if that child can't articulate much or anything, people will discount the hypermobility that they
Mm.
have and just say, "Oh, yeah, yeah, he's just bendy, it's not a big deal." But here's the thing, that child has pain. If they have
Yes.
hypermobility, they have pain. And just because they don't articulate it the way we would, doesn't mean it's not there. And then
Right.
the other thing is, there's an interesting deal with pain threshold and people with EDS. I can take a lot more pain than most people that I know without reacting to it particularly, simply because my level is set high. That's one part of it. So when exercising, first thing people tell me is, well, if it hurts, don't do it. This doesn't work for me. I can get into a position or I can do something that causes a significant injury, and I might not know for 2 days because I already have a level of pain
Yes.
and I can't tell the difference.
No. Is it
So
normal pain? Is it extra pain for significant?
so
Yeah.
if I can't tell, how is a child with autism going to
Exactly.
tell?
Yes.
So often these kids can end up with a lot of pain, then their behavior is such that, they're
Reflects the
acting
pain.
out
Yeah.
and it reflects the pain.
Yeah.
And people start treating the behavior, or, they label the child as a problem child or whatever, depending on their knowledge base, but they'll slap a label on the kid and say that their behavior is stemming from their attitude rather than from the fact that they have a whole heap of pain because possibly something's out of place
Yeah.
or it's just not where it needs to be. And they
Yes.
can't articulate the pain.
Or they
So,
couldn't tell you what level it's at. On a scale of 1 to 10,
or
where is
even
your pain?
identify it,
It's like it's
or even
just
identify it,
yeah,
because
identify.
sometimes we don't have, if you don't have the language for the
Yeah.
thing, if nobody bothered to teach it to you yet because they don't think you have any, then you might not be able to sort of let somebody know because you don't know what it's called. You don't know what it is. And I have actually come across adults within the last 3 years, let's just narrow it down that much, who have said quite literally, oh, this child does not feel pain. That is the biggest crock of you know
Where did
what
they get that
I've
from?
ever
Every
heard.
child feels pain.
Of course they do. But I've actually had adults working in the field say that to me.
How?
The child
How?
doesn't feel pain. And it's
Where
like,
did they get that from?
because the child doesn't respond the way you expect a kid in pain to
But
respond.
but, but it, every child. I mean, if you touch them and if they
Oh,
fall
I
and get an
know,
owie, it's like that
but they
child
may
is
not,
feeling pain.
that child might not respond in the way you expect them to. And so the adult who frankly ought to know better, but apparently doesn't, is going to look at that kid and say, well, they don't feel pain. I've had somebody say that to me.
I can't
And when
believe that's
I was
astounding.
able to speak again, I was
Yes.
able to point out that, yes, their baroreceptors for the pressure and, their pain receptors are all intact. There's no reason for this child to not feel pain just because it doesn't look the way you think it should.
Right.
But this is something that happens a lot too. And I think a lot of kids with autism probably also have EDS, or at the very least, they have hypermobility syndrome, meaning that they're way too stretchy and things can hurt. That is a thing that a lot of these kids face. And particularly if they're not verbal, it's not recognized.
But
And so
even
it's
if
not
they are
taken care
verbal,
of.
can they point to where it hurts? Because, as you said, like you had your shoulder out for 2 days before realizing it because your whole body hurts and you didn't
Right.
know there was a particular pain there. So you can ask them, where does it hurt? Or on a scale of 1 to 10, how does it hurt? And they can't really tell you because everything hurts. So they can't pinpoint an area.
Right. And that's absolutely true. And for a child with EDS, they don't necessarily know. My youngest, he's sort of ability to perceive pain was not what you would anticipate when he was little. And so, I remember a time he was running across the playground and he fell over, skinned his knees, and the blood running down his legs and everything. And he got up and he just sort of went, oh, brushed off his knees because he was frustrated and kept running. And same kid broke bones, I think, 2 or 3 weeks apart, 3 different injuries. And we had to keep going back to the same hospital. And
Oh,
I was
no.
saying to them, okay, he was at school for this one. He was over here for this one.
Yeah.
No, we're not beating him up at home. But he would get broken fingers or whatever and not behave as though something was broken. And so unless I insisted on an x-ray, the doctors would dismiss it and say, no, there's nothing wrong with him. I'm like, no, really there is. I can see that there is. Just because he's not reacting in a way
Yeah.
you expect him to doesn't mean it's not there. And there'd be a broken bone. And
Is it, and I think fibromyalgia is beginning to be taught in medical schools. I'm not sure, but it has become more commonplace where people understand, they don't understand necessarily what it is, but acknowledge fibromyalgia. Is EDS even taught in medical school?
I'm going to say no. It is very much a specialty that a very few doctors will seek afterwards. And by and large, those who are doing research have EDS.
Mm,
There's
or
a
family member
female
has, yeah.
doctor.
Hmm.
There's a female doctor. I can't think of her name right now, but she's pioneering research in EDS. And she spent years being told by her male colleagues that it was all in her head and she was a hypochondriac.
It's amazing how much
Um,
we apparently have in our heads. Our
right?
bodies, just around, separate from us altogether. Yeah.
This this women being hysterical thing
Yes.
seems to have been around for centuries for some
Yes.
reason.
I have
And yet,
unectopic pregnancy and they were telling me it's in my head.
oh, my first baby was in my head. Like literally when he was premature and when I went into labor with him, they said I was excited. The machine, they clip onto the skull. The machine wasn't working properly, so it didn't show the contractions. And they said, no, 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 you're not in labor, you're excited. I'm not bloody excited. I'm having a baby, you know. And he was arriving before I got to the labor room, and I had to sit up and hold his head so that he wasn't delivered too fast. And he ended up with his skull sort of excessive molding, which gave him a brain hemorrhage and all kinds of things. Why? Because they didn't believe I was in labor.
Why aren't you believing the
In my
woman that's
head.
in it? I mean, this is the thing, is that I've come across this in my life too, the dismissiveness of doctors. And when you talk about your symptoms, I had a ruptured cyst, and because it was behind virtual organs when they did the scan thingy, it didn't pick up. And I was just getting sicker and sicker because just the toxins were going in the body. And it took kind of one young doctor to go, I think there's something else I want to do a laparoscopy, and then discovered it. But by that time, all the toxins from this cyst, but apparently been huge, had poisoned the body. And where all the other doctors, no, no, it was just, you just had a pain. Maybe it was, um, something Q8,
Right.
right? And it's like,
Or it's in your head.
why do they not listen to people who are actually in the pain and pay attention? We can't always articulate in medical terms what's wrong with us, but we know there's something wrong. And
Right.
here in BC, if you don't have a doctor, you have to do a virtual doctor. It's one question, 3 minutes. That's it.
Wow.
So, you may have a symptom of something, but that doesn't mean that's the root cause. And you may not be able to
Absolutely.
articulate it because you don't know what's going on. You're not the doctor. And
Well,
immediately
it's
they just slap a drug on you or this on you and that on you, and you come away still feeling lousy.
Well, very often the symptom is simply the last step in a chain. And what caused it in the first place is down the road. You have to have
Yes,
a good look for that. I mean, I'm a former nurse, so fortunately for me,
you
I
had some
know a
insight.
reasonable amount about
Yeah.
what's going on. But still, sometimes you can't really pinpoint it's this is what's happening. That's what the medical professional is there for, ideally. But the number of times that they will hear hoof beats and think horses, even
Yes.
when they can see a zebra, is, they know it's a zebra, but they're still going to say it's the horse. They
Well,
just,
because they don't understand what the zebra is. And
and,
it
and they don't
and
really want the inconvenience of
the
something that's difficult
inconvenience
to
or sometimes
diagnose.
is the ego. I
Yeah,
don't know what it is. So instead of, I have not come across this before. I don't know what it is, but I'm going to do some research on it. It's like, no, no, it's non-existent because I don't know about it. So
right.
yeah.
And particularly the older doctors
Mm.
are absolutely stuck in what they know. And if you don't fit into what they know, then you don't have a problem. But actually, you have a very big problem. So that very big problem is all in your head,
But
especially if you're a
that was the
female.
older doctors with me with the ectopic pregnancy, and it was a young intern that had to persuade them to do a laparoscopy on me. And then I had an ovary and a tube taken out with a dead baby in it. right? And I was in so much pain before, and it was nope, no, it's all in your head. And even the doctors, it's like, oh, you've picked up a CD, sexual disease thing. And it's like, no, it's anything but. And then this young man pushed for it, and then it came out the other way. But it's like, it's always been the young interns that have
Hmm.
stood up. Yeah, I got bitten by a spider and my body was going paralyzed and I was hallucinating. Oh, she's just on drugs, was the older doctor. And young doctor asked me questions. Have you been camping? Yes. Where have you been? Ah, did you have your window down in your car? Yes. And he started looking over my body and found the bite of a red button spider. They're tiny, like a, pin nib. And immediately got me on the right drugs for it. Otherwise, I would have been paralyzed in the next couple of days. Right. So
Crazy.
the thing is, one thing we're not taught as patients is to demand answers. Look, if you don't know, I want you to do the research, or at least give me something to do the research, because this isn't normal, right? This
Hmm.
isn't normal. You can't just give me an antibiotic or an antidepressant for it, which they love to do. We need to get to the bottom of this. But I feel that, especially since COVID, we're in a medical crisis where an awful lot of doctors have resigned with shortage of nurses. Um, you've got more nurses turning up into practitioners, like between the doctor and the nurse, and they actually are more attentive and ask more questions. But we're in an interim of crisis right now, and I think that there was one show I did a while ago where it's a university where they integrate Western and alternative medicine in the same teachings, which
Oh,
is, I
good.
think, quite honestly, the way it should go for all
Mm.
medical practices, that you need to incorporate other alternatives in there and not just black and white.
Yes, definitely. Well, I'm currently studying functional nutrition and integrative medicine at master's level, and I'm doing this for fun.
Hmm.
I don't have to do this, but I'm doing this because I want to know how to navigate the landscape that we have right now and how to help other people.
Right.
Because if you don't take charge of your own health,
Hmm.
you are shafted. Nobody else is going to look after you. We
Right.
don't have in Canada or in America, there is not a healthcare system. There is a disease maintenance system,
Yes.
and you're barely getting that these days.
Yes.
And so, a big thing for me is we have the food industry that, particularly in the US, is poisoning us with chemicals that they know our bodies don't use as food. Our
It's
bodies don't
it's literally
recognize them.
changing the chemistry of the body,
And
right?
the same companies sell products in Europe and cannot put those chemicals in
Right.
Europe. They're banned, but they
Yes.
still use them here,
Yes.
knowing what they
Yeah.
do. So you have the food industry that makes you ill. The pharmaceutical industry keeps you there, it
Yes.
maintains you at that level. And then, just to confuse the issue, you have the diet industry that comes in and says, oh, you need to eat these foods and not those foods. And by the way, buy our special packages of whatever for 3 times the amount of money that they should cost. People have no idea what to do.
No.
And did you know there are 257 names for sugar, for example?
Isn't
There
sugar just
are.
sugar? Well, I mean, there's cane sugar and there's this sugar,
No,
but
there are 257 names of sugar. There might even be more by now. I can send you
fructose
a,
and
I'll send you a list of them.
yes,
But
I'd love to post that actually.
if sugar wasn't such a terrible thing, if it wasn't the other white powder, why would you need 257 names for it? But you can pick up a product, a food-like product with a label on it, and there is a long list of things. You might have sugar on there 8 or 9 times,
And you don't
and
know
you
the
don't
name of it.
know.
Hmm.
You don't know because they used all these different names.
Right.
And then there are other chemicals that, it preserves the item. Well, the item might not have been meant to be preserved for that long. So you're eating, it's a bit like eating a pickled body part or something. Like, why would you?
Yes.
It isn't food. If you look at in the US, they have these cakes, Twinkies.
Yes.
Pick up the box and have a look at the expiry date on that sucker. It's going to be 2 years away,
Right.
3 years away.
Yeah. Well, when
Nothing.
any watch an Armageddon movie,
Right,
Years later, they find a Twinkie, still
right.
okay. Yes.
And the thing is, there's nothing natural in that product.
No.
And when you find enriched foods, what that actually means is they took all the vitamins and minerals out and they replaced them with chemical facsimiles. Why? Because the original, the natural substances shorten the shelf life. They will go rancid, they will go off. And so the product has to be sold very, very quickly and consumed quickly, or it will go off. How do you fix that? You take out the natural stuff, put in the chemical stuff so that the FDA stay off your back. And there you go. But your body, meanwhile, is trying to process this
Yes.
and has no idea what it's looking at because it's not food. So, given that, is it a surprise that we have so many people with fibromyalgia, with EDS, with other chronic pain conditions that seem to be
With diabetes.
autoimmune
Yeah.
related?
Yes.
There's a lot,
Diabetes.
there's a lot of autoimmune conditions out there.
Yeah.
And
Kidneys.
further to my studies, what I discovered was that it's something like 90%, it's a very high number anyway, of the American population in particular has chronic systemic inflammation. So you have inflammation throughout the body in all the blood vessels and so on. Now, this is where cholesterol receives the signal, we have a problem here, go fix it. And cholesterol tries to smooth over any rough areas in the vessels. It's like a band-aid.
Mm.
So when that area becomes more inflamed, the band-aid starts to peel off. And that's when you have a problem with cholesterol in the blood. It's not the cholesterol that's a problem, it's the inflammation that's a
Right.
problem. We have inflammation because we're eating food that's not food. And the food companies are lying about it all the time because they can. And nobody calls them to order because they have the big money.
Well,
So
everything goes down to money.
it
Everything.
does.
Your
It does.
lobbyists out there that are lobbying, the guns and the food and this and that, it's all to protect their industry. A pharmaceutical, I used to have a wonderful woman on for 5 years. We called her snake oil woman because back in the 60s, she was, your snake oil woman because she was promoting Avida medicine, alternative, everything about natural. And she used to call it, that the real pharmacy, Farm.
Yes.
ACY pharmacy, and that they're natural and away from the chemicals. I really do believe that a great deal of our depression, anxiety, and anger that is in society today is coming from the reconstruction of our brains through chemicals.
Oh, definitely, definitely. I mean, Monsanto is a company that basically rules the food industry,
Yeah.
and they're the same people who produced Agent Orange. Now,
Yes.
I don't know about you, but I tend to think that the people who made Agent Orange shouldn't be in charge of our food,
Yep.
but they
I've done
are.
marches on that. Yes.
And they are, and they're extremely powerful. And
Yeah.
any farmer that tries to go against them
Yeah.
gets taken to court and whooped because they can afford the
Yep.
most expensive and best lawyers, right?
Yes.
So this is the world we're living in right now, trying to navigate with, these pain conditions that I wonder how much would be different if we were actually able to access food that hadn't been messed with. For
Yeah.
example, corn. If you look at the cornfields now, back in the day, they used to be, the corn would grow tall, a windstorm would come through and everything would get knocked down, and you're going to harvest it as quickly as you can, right? Because the wind would knock it down or heavy rains. That doesn't happen now. Corn plants are a lot shorter and stockier, and nothing happens to them when it
Mm.
rains. They have been genetically altered. Another thing that has been done to the corn plant is it's been bred to have a sort of inbuilt herbicide. No, sorry, insecticide. So if an insect comes along and
Yeah.
bites the corn, it dies. Well, you're eating that thing.
Yes. Well,
You know,
it's
that
the
is
same with your
that is
meat
in so
market.
many,
Look
that's
what's
in
in
so
the
many
meat.
foods.
Yeah, exactly. I mean, all of our food needs to come into question now. It really does. Um, we've become rather complacent. We call it center aisle. And the thing is that kids think that food grows in supermarkets, and take them to a
Hmm.
farm to show them how things are grown. take them to a meat farm and hear the screaming of those animals. And you tell me that eating that bacon and that beef from an animal that is that terrified, that is being pumped with so much other additives, that you are not eating that fear and you're not eating those chemicals.
Oh, for
Right.
sure. You've got the hormones and so on. I mean, we do eat meat in this house, but we buy organic from the farm,
Hmm.
which is, I'm not saying that means, our hands are clean and everything's wonderful, but we're doing the best we can with
Yes.
what's available. And
Yeah.
that's all you can really do. And that's why I'm doing this research and I'm studying the functional nutrition and integrative medicine because I'm trying to navigate the landscape that we have right now that is frankly treacherous because nobody gives a damn. They just want
No.
the money
Well,
and
there
they
is
don't
another show where
care.
we need to break that down and really talk about the nutrition's alternative, because a lot of the time people go, okay, all right, you've told me this, everything is bad, but where do I go and get good? What can I
Absolutely.
take that's good? And I think, we need to show them that education, the good versus the bad and how you can get the good. Yes, you're going
Well,
to pay more
the
for it,
better,
but better. Yeah.
the better versus the really
The
not very good at all.
no,
That's kind of what we have.
right.
Absolutely.
And a lot of people just don't know. That's the problem. One of the reasons behind doing the Forgotten Children series is that each one of you are contributing a chapter, and we're talking about the problems with our children that are adult made.
Oh,
We're not
yes.
we're not nurturing the child when they're young. We're not giving them a voice. We're not liberating them as children growing up, or teaching them those boundaries, teaching them how to navigate through life. Where instead it's conform, obey. And then we end up with dysfunctional adults that don't know how to navigate life, and they get all upset and all uptight and go down the rabbit hole. And this is all because we're letting our children down, and that's the reason for the book. And next year will be, or the year after will be actually a book on nutrition and health, and how we
Oh,
might come first before the business coaching. We'll see, because there'll be two books
well,
a year.
book,
But
book me up for that. I'm
right,
totally there
exactly.
for that. But,
Exactly.
on the subject of cholesterol, another thing that a lot of people don't realize is cholesterol is necessary for every single cell in your body. It's what keeps the cell membrane sort of intact. It's what allows nutrients to pass through the cell membrane is cholesterol. So if you don't have cholesterol in your food, if you're going for the low fat versions, you're screwing yourself up right there. But here's what happened. The cholesterol does not have a lobby group, right? Nobody's
Right.
lobbying cholesterol's great, but they are lobbying for sugar.
Yeah.
So when research was done, and oh, yes, there's a problem with food and illness, the sugar companies are like, no, 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 you can't blame sugar for any of this, but we can blame fat.
Yes.
So you pick up a yogurt, for example, that's been messed with, and they say it's low fat. Check out how much sugar you've got in that thing.
Uh,
You might as well go get a cake.
yes.
Frankly, you'll like it better, and there'll be less chemicals in it probably. But
Right.
sugar increases the flavor where fat has been taken out and the flavor's gone with it. So naturally occurring fat, definitely not the hydrogenated stuff, but naturally occurring fat is actually what we're meant to eat. Like that is something that we need. It
My
is
mum,
required for health.
my mum lived to 95, and she was whole milk, whole butter, never margarine. Everything was whole. It had to be whole, proper cream. And it was, none of that. Don't you bring margarine into this house,
Quite
right?
right, too.
And it
If you
was
look
all
at
the natural
France,
fat. Hmm.
if you look at the way people in France eat,
Yes.
they don't eat low fat anything.
No, it's very rich,
But
but moderation. They don't eat a
I was
lot
going to
of
say
it. Yeah.
the
Yes.
portions are in control, which, in the US particularly, the portions are insane.
Yeah.
I remember the very first time I came to the US, I went to a restaurant with some friends who were from here, and we sat down and we ordered steak. And I was given a plate, and I looked at it and I thought, well, okay, it's a bit odd, but all right. And I started to cut up the steak because I thought they had given me the steak for four people. And actually, no, that was for me. And my friends were laughing and they said, no, 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 that's yours. And I looked at this half a cow on a plate and I was like, you're kidding me. Nobody can eat that. And then I looked around and people were in fact eating that.
Mm,
But it was the biggest thing I'd ever seen on a plate that wasn't meant to be shared among a family.
right.
It was massive.
Well, when
And
you look at so many people that, are obese, but they're malnourished.
yes, yes, I have a big thing about that too, because we are fed so many empty calories.
Yes.
Your body has a nutritional hunger. Your
Yes.
body is saying, okay, I get you. We've had all these calories. That's great. Where's my nutrition? Eat more.
Yes.
I
Where's
need
my
nutrition.
substance that makes
Yeah.
me go?
Where's the
Yeah.
stuff that I make me
Yeah.
out of?
Right.
And so eat more so that I can get that.
Right.
So that person is genuinely hungry. They're not
Yeah.
being greedy. They
Hmm.
just haven't had food yet.
Right.
They've had calories, but they haven't
Yes.
had food yet.
Yes.
And they don't know. And if you think of those you know, big orange bags of snack that, the Cheetos,
Yeah.
you put that kind of thing in your mouth, what happens to it? You get this intense flavor, this insane color, but it reduces to this little glup, this little
Yeah.
piece, something. So you can eat a huge bag of these things while you're watching a movie, for example, and in your stomach, you've got this small lump of stodge that's very heavily flavored and chemically laden with things to increase your appetite. So you want to keep eating them. But the nutrition in there is nothing. But the
No.
calories, man
Yeah.
alive, you just ate
Oh,
a
well,
whole
now you've got
calorie.
another problem because you're bunged up. Now we have another problem of releasing,
Right.
right? So clearly all of this has got to go into the next show. But the question is this, if you have EDS, do you have stomach issues? Because I
Yes.
mean, everything is, to do with your
Yes.
muscular being weak. Does that mean, do you have IBS or is it, because IBS, folks, isn't all about just going. It's not just all about diarrhea, it's about constipation as well. So,
So there are people with EDS. I am not one of them. There are people with EDS who have gastroparesis, which means literally it don't move.
mm, yeah,
Your motility, your gut motility just isn't happening. And they can have massive problems with this. It can be a huge issue. Like I said, EDS affects different people differently, and
right.
it will show up in different parts of the body more so than others. So I'm very fortunate there, but I know that there are plenty of people with EDS that do have gastroparesis. And when you're eating this stuff, this facsimile of food, it's not honestly food. If you have to label a thing food,
Yeah,
you can be pretty sure it's not food, right?
right.
You don't look at the produce section and see carrots, food. They don't have to label
Yes.
it as that. But if it comes in a box, particularly, or a packet, to a large extent, cans these days, those things are suspect.
Yeah.
That's not really food. You have enough
Yes.
problems trying to find the stuff without pesticides on the perimeter of the store,
Mm.
but going into the middle is that's a chemical
City.
storm.
Yeah. And
It's
this
just
is
a
the
lot.
thing with whether it's fiber or EDS is that it's hypersensitivity,
Mhm.
right? And so that means that your body is going to react to everything in a hyper way. Whether it's to pain, whether it's to chemicals, whether it's to touch, whether it's to the wrong movement, your body is going to react to that. And this is where, this show is called Your Health is Your Choice, but we've got to know what we can do for our bodies that are
Mm.
going to sustain our body in a healthy way to the best of its ability. And that means we've really got to get to know what part of EDS, what part of fibro you have. What are your things you can push through? What things agree with you? What things don't? What amount of sleep do you need? When do you need to rest? You've got to be so in tune with your body and know it. And don't be flippant with it. Don't be go, oh, so what? I put my shoulder out, I put it back in. Don't be flippant with it because
Oh no.
it's going to come back and say, well, now you need an op, right?
Right.
Well, how did I get there? You didn't pay attention, right?
Yeah. And that surely can happen. Yes, definitely. But certain foods do cause flare-ups in people, whether
Yes.
it's fibro or whether it's EDS. There are certain foods. And this was not the case 50 years ago.
No.
This is not what used to happen. And we've had the advent of all these new chemicals. High fructose corn syrup was developed in a laboratory in Japan in, I think it was 1974. And by the time 78 came around, the food companies had discovered that this thing was mega sweet and really cheap to produce. And so they could start putting it into foods to make the food more interesting to eat, to enhance the flavor. And food in America is generally a lot sweeter than other countries. So when I lived in Canada and I would come to the US, funnily enough, for the World Spinning and Sports Conference, because I'm a lifetime spin instructor, one of the things that would happen is everybody that had come in to the US from elsewhere, on day 2, they would say, okay, who here has a carb headache? And
Yeah.
all the people who were not from here are raising their hands looking, like, what happened? But
Yeah.
even the bread is so sweet
Yeah.
that you can taste it if you're not from here. But when you're living here, your taste buds get used to it.
There was a
And
guy from Australia that came over, and I think the movie is called Sugar something, and he drank the smoothies. He ate the diet here. He gained a great deal of weight, and he found headaches, and he found like his whole body started kind of to malfunction because
mhm,
of all the sugar in it, all the hidden sugar, right?
right.
And the obvious sugar. That when he went back to Australia, it took him 3 months of diet and rest for him to get his body back to the way it was. And this is like he was interviewing, this is one that stuck with me, interviewing a 17-year-old who had no teeth because he lived on like
Mountain Dew.
Mountain Dew. Right,
Yep.
right.
Mountain Dew mouth is actually a thing in Kentucky.
Well, the thing is he still drinks it and
Mm,
and his sister puts it in the baby bottle.
yes,
And I
yes.
go, hello.
Oh, I
He's
have
just
seen
lost all
kids.
his teeth at 17 due to Mountain Dew. He's still drinking and you're putting in the baby bottle. I mean,
Yeah.
hello, you
I
know?
have seen kids in strollers with a Coca-Cola and a donut, and that's
Uh,
breakfast. Now,
right,
I don't know what kind of brain you think this kid is going to create from that,
right.
but I think we can look around us and see where it's going.
Yes,
And that's not a very positive thing. But this is not food. This is,
no.
I don't even
This
have a
is bulk.
category
This
for
is
it.
bulk. It's fillage. It's not food at all. It doesn't
And
sustain.
no, and it's just appealing to the reward centers of the brain that
Right.
say, hit me with the sugar, hit me with that feeling, because it produces that high, right? You have the sugar high and then the sugar crash. Even if you're not diabetic, you get
Yeah.
that. It's the same with things like caffeine, right?
Yes.
Somebody who drinks a lot of coffee, they get the high and then they come down, so they want more coffee. It's the same thing with sugar. I mean, sugar is literally the other white powder.
Yes.
It's um it's
Yes.
it's hugely
It's
problematic. Now,
yes.
if
The
you've
other
got
white powder
people,
for cocaine and sugar. Same
yes,
bracket. Both addictive, both
and
dangerous.
both mess with your brain.
And one is legal and one isn't.
And both mess with your brain,
Exactly.
But if you are trying your best, you sort of know I eat a low sugar diet and I'm doing really well. Unless you have your 257 names to hand, you have no idea if you're doing well. Because
Exactly.
honestly, they are shoving that stuff in everywhere they can without telling you what it is. So,
I have a 29-month-old grandson who's vegan. And this is a solid, healthy little boy. He looks way older. He's very healthy. He's a solid little boy. He's quite heavy to pick up now. Not fat at all, just really big bone structure. And all he eats, and they will not have sugar. They don't give him sugar. If they give him anything, it's got to be natural fruit. He eats a lot of fruit, um, but natural fruit and an all vegan diet. So he's not allowed sugar. If it very rare that he ever gets it, if he's somewhere else, so they're out. But otherwise, it's the natural sugar from vegetables and from fruit.
which is great, particularly if you eat it as the whole fruit. I
Yeah.
have to say, though, the vegan diet, it would be great for your daughter and son-in-law, I think that's the way around it
Mm.
is, to have a look into the myelin sheath, the piece that covers the nerves, because there is a certain thing in animal product that you don't get as a vegan. And you tend to have a 6-month supply of this, and it can lead to nerve damage
Mm.
in some cases. So it would be worth them investigating that so that they know what they're working with.
Right.
I'm not going to say it's a bad choice. I'm just going to say investigate that piece so that you're informed,
Yeah.
because it can be problematic for some people. I
Yeah.
have I have come across that. I've been vegan in my life. I lasted about 6 months. But I did that in the 80s when there was no vegan food. So it
Or
was a lot of
no, there's
work.
a stack of good vegan food now. I'm
It was a
80,
lot of
I'm
work.
80 20. I'm 80% vegan, that 20% when I go out to go to someone else's place where I maybe can't get, a good dish or you're not quite sure how it's made. But at home, I'm probably more 90, 95% vegan because you can take my meat. I'm quite happy. Don't touch my veggies. I love my veggies and all the various ways that I can make them. So yeah, but I think it's also knowing what your body needs, right? Knowing what agrees with your body, knowing where your food is coming from. Whatever condition you have, EDS, fibromyalgia, anxiety, depression, fatigue, all of those things, I think diet is a huge component of being able to stabilize. Well, may not be the cure,
Yes.
but certainly stabilize and make easier.
Well, a lot of people will push back on that and say, don't be silly, how can food do that? But think about
Mm,
it.
yeah,
Food
it's
is
our
what
fuel.
makes us food is what makes us us. You
Yes,
make yourself out of the stuff you eat.
exactly.
So you're making yourself out of either good quality or inferior quality. And you can't make a silk purse out of a sow's ear. It's just that's not what's happening. So if your kid's having Mountain Dew and
Yes,
a donut for breakfast, then they will have teeth rotting out of their head before they've even had the second set in.
exactly.
And their brains aren't going to be working too
No,
well. You didn't give it anything to build from.
people will put better quality gas in their car than they will put food in their body. And
Yes.
you,
In
you've
fact,
got
I
to look
saw
at
a
it, it's the
thing.
same thing. The food in the body is the fuel for the body. The body doesn't work unless it's on the right fuel.
I read a thing from the Dalai Lama one time where he was visiting New York and looking out of his hotel window. And what he observed was people would spend lots and lots of money on fancy shoes,
Mm,
but then they would spend just a few dollars on, buying a fast food burger or
yeah,
something. So he was very curious about the priorities there.
yeah,
You'll spend a lot of money on what you're putting on the outside, but nothing on the inside.
yes. And life is an inside out job. We say that all the time,
It
mentally,
sure
spiritually,
is.
physically, emotionally, and everything is an inside out job. And if you do get given, a disease or a dysfunction in the body that is hereditary and it's part of your mechanics of the way your body is, then it comes down to how are you managing it? Are you looking at it as a whole? How do you understand it? Do you know your limitations, your boundaries, the things you can and cannot do? Do you know what helps you actually fortify? And what really nourishes your body? And, back to the your health is your choice. It's that you may be given something that you didn't want, you didn't like. Nobody likes this, folks. Fibro and EDS is not fun, right? But at the same time, it's that we've got it and it's with us for life. So what can we do where we are in charge and it's not in charge? And that means
Right.
you've got to be in tuned with your body and understand what your body needs and honor that, but also always keep up with the research because new things are being discovered. And as you say, being a part of a group where other people are sharing, somebody shares a tip with God, I didn't know that. And you use it. And my God,
Mm,
that was a life changer, right?
exactly.
So please have no shame or blame of what you've got. It is what you've got. It's the hand you were dealt, right?
And
No
I
shame and
actually
blame.
find the concept of shame and blame about having a condition of
Hmm.
any description to be kind of bizarre, really. It's
Yes.
like, well, I have this extra challenge, and so I'm being blamed for it. Like, that's just weird.
Yeah, well,
That
like
is
if
a
people get
strange
cancer,
thing.
and everybody feels sorry for them, if you've got another illness that is ongoing and isn't going to have an expiry date, it is like, well, what are you doing wrong?
And funnily enough, the research shows that sugar feeds cancer. But do
Mm,
you think that that research is commonly made
no.
known to people? No. Again, the sugar industry and their lobby, they're powerful financially
Yes.
resplendent lobby take precedence over your health. So they would rather pour billions into research on how to fix cancer rather than just sort of say, okay, eat these foods that are whole foods, don't eat sugar, and you'll do a lot better. And I don't mean to sound flippant about somebody having cancer, but I am rather irritated with the research that is
Yes.
known, it's out there, and it's not being disseminated to the people who need
No.
it.
No.
And that is a problem. And
Very.
sometimes you will have doctors that don't give particularly good advice, but a lot of them get maybe an hour of nutrition in their
Yes.
whole
If.
time in school,
If. Yeah.
if that.
Yeah,
And
I've got a story
but
on that, which is actually fascinating. A woman and her brother and the mother died of cancer, and then she actually went down aromatherapy and oils and everything else to keep well, but she got cancer. So did her brother, but he was a co-owner of the Lakers, so he went to the best doctors. Well, they did a few operations on him, over-radiated him, and killed him. She went and did the two feathers Indian method. And she literally took out 18 growths out of her body and put them in a jar, took them to a doctor. And he didn't believe her and said, no, you still got to have a mastectomy. She said, I'm cancer free now. I've taken them all out. I don't believe you.
yeah,
Right. So this is where we need doctors to get off the high horse and understand there are other modalities that have been around for thousands of years. Yes, antibiotics, fantastic. What you can do with the body with heart transplants, lung transplants, and all these type of things today, absolutely miraculous. Nobody's undermining that at all. But what we're saying is do not undermine the other techniques that are out there. Instead, incorporate, right?
absolutely. I mean, there's room for everybody.
Room.
And aspirin comes from the bark of the willow tree, for example. So now we have chemical aspirin, but
Yes.
it's based on the bark from the willow tree. So, this is natural. If I said to you, oh, you have pain, try this willow bark.
Yeah.
A lot of people would look at me and say, oh, I'd lost the plot. But all I'm
Right.
saying is, here's some aspirin.
Yes.
Like it's the same thing. So why is one better than the other? Because one's in a laboratory?
Yes.
Um,
Yeah.
I got to question some of that.
And in the laboratory, what else are they adding to it?
Well,
Right.
precisely because it's chemical, it's not natural.
Yeah.
So
Because
that
they've got to make it go further and they've got to make more of it. So they're going to break it down and put additives in it instead of the bark of the tree, which isn't going to go as far.
well,
Right.
they
So
don't
it's
even use the bark now. They
right.
take
Exactly.
they take the chemical components that they have found in the bark. But the thing is, there's
And
often
synthesize it.
something extra missing.
Yeah.
There's something that they haven't detected yet that's in that natural substance that isn't in the chemical substance. So, but I mean, to be fair, they want to standardize how much you're getting in a dose, and that's kind of hard to do with a willow bark unless you have someone that's skilled in it.
Mm.
And we're getting less people that are skilled in it because it's been, systematically marginalized for
Yes.
years. So that is problematic to say the least.
I think
But
actually in a lot of ways people are kind of going, I've given Western medicine the chance. And, I have to now look to these other modalities. And I think more and more people are looking, what else is out there. And those people that have been marginalized and feel that they were on the way out, they're now making a resurgence because people are taking their own health, especially after the pandemic, especially where there's so many doctor shortages. Like in England, they're on strike all the time. Nurses and doctors are on strike all the time. And
and
so,
having been a nurse in England, I can understand why.
oh yes,
I've been there
it
and done
used to be
that.
the
I get
best
it.
in the world, and it went down to third world. Just really bad. My brother and sister have just been through that, and just the horrific stories that I've heard from them. And so, what we're looking at is like the Almighty medical has lost their grip, has lost. Their fluidity of what they're doing, and other people are going, well, I can't sit around and wait for an appointment that's only going to come up in 6 months. I need
Mm.
to look elsewhere. Um, this is where social media has come in, where people say, I have this, and what else has anybody else tried? And it is still buyer beware. Ask the questions.
Very
Go to
much.
the source, please, of the people that are providing it. Don't just carte blanche it because it may be the wrong thing for you. But
Yeah.
this is, I think, where, we need to take some onus over our own health, our own investigation. Whether you have EDS or fibro or not, we've just really got to take onus over our own health and know what else can help us that it isn't chemically produced
Well,
and go back
honestly,
to the farm pharmacy.
I think everybody needs to take responsibility for their own health
Yeah.
because the medical profession are overrun.
Yes.
We have got we have this strange thing. Like I started nursing many moons ago, long time ago. And when I started nursing, we in the UK still used some pretty basic remedies sometimes. So, for
Mhm.
example, if somebody had an infected fingernail, for example, you wouldn't slap antibiotic stuff on that. You would soak it in salt water
Mhm.
and it would work.
Yeah.
I have used this many, many times, and I've used it for people who have been on antibiotics. The antibiotics didn't work. I get them to use a poultice with salt water, and that works wonderfully because it draws out the infection.
Yeah.
It's pretty simple, and there's no side effects, right? And we actually used to do that in the hospitals. We would
Yes.
do a lot of things that were very straightforward, and now it's all medicine. And one of the things is taking blood pressure, for example, a simple action. These days you get strapped to this machine and the machine over squashes your arm, and boy, I don't like those things.
No, they
And
hurt.
they give a readout.
Yeah.
But here's what they're missing: the machine does not feel how strong your pulse is. The machine does not feel if your pulse is regular or not. Now, some of them may have a threshold where they'll alarm if there's a lot of skipped beats, but if you're doing the blood pressure manually, you can feel any skipped beat and you can notice that. If the pulse is thin and thready, or if it's strong and
Mm.
hard, you can feel all these things. And then the other thing that no machine is ever going to be able to replace is the human touch of you're
Yes.
actually touching someone to take their blood pressure. And
Right.
that touch is a huge part of the healing for a patient. And
Mhm.
we found this all the time as nurses, that the more we could literally be in touch with our patients, the better they did. And now we have this very impersonal machine that just gets slapped on your arm, it whirs up, it drops down, and they give you a readout. And there's so much information they're missing from this. So we've gone backwards while going forwards.
Yes, exactly. Exactly. And that's the thing is that EDS is still a misdiagnosed and unknown disease. Fibro is still one of those things that is becoming a bit more mainstream, where people, when you say you've got it, oh yeah, oh, okay, don't know what it is, but they've
Right.
heard enough of it to understand. And they still don't know what you go through because, of course, you look all right. Um, and it's, but in a lot of ways too, people simply don't care. Right. And I think that's something that's happened also. We used to care about what other people were going through. We were more supportive. And it wasn't like we're feeding the misery. We're just understanding, having a bad day. Okay, what can I do for you? What can I do for you? Even if it's just like, just have a phone call and a chat, right?
Mm.
Something to pick you up. We were more present with each other and helping each other through things. And now it's become, oh, you've got that. I don't want to know about it. Not going to communicate.
Yeah, I think social media has a lot to do with that. People's
Mm.
tolerance for
Yeah,
things, they've become desensitized to a
especially
lot
after
of the
COVID.
human condition.
Yeah, yeah,
People are desensitized to a lot of things
yeah,
because they have this input all the time.
right.
And so when it comes to a sort of genuine, compassionate human interaction, many people just don't have it. They're just not there. They don't have that experience. They don't know what to do with it. They don't relate. And if you bring in, particularly here, but not only here in the US, you bring in the political divide,
Oh,
and you've got an even bigger problem.
yes,
And frankly, both sides have issues as far as I'm concerned. So
right.
I'm not down on the side of either of them.
Mhm.
But there is a problem with that divide because everybody's yelling at everybody
And
else. You
nobody's finding a
idiot.
solution. Work
You're an
together to
idiot. You
find
don't
a
know what it
solution.
is.
No, yeah,
They're not interested in a solution. That's
no,
the problem. And
yeah,
it feeds into that lack of compassion. It feeds into that lack of caring about the person next to you. And if you happen to discover that they have different political views, well,
mm,
that's it. That's your problem.
yeah,
And why? Since
right,
when did that become the biggest deal? You know?
yes. Yeah, we
So,
used
but
to be
that's
able
where we
to
are.
debate. We used to be able to talk it out. We used to be able to listen to each other. And, I've said this before, we've become headliners. A
Yeah, oh yeah.
statement and like no context, no content, just, not willing to go into the deep talk. I even get this with podcasting. Well, your podcasting is too long. No, we unravel here. All the things that people have learned just in this particular show. If you're wanting the 10, 5 minute, and there's some podcasts that are 3 minutes, they're headliners, right? They're not depth. And if I find that's what you want to do, but how is it serving people? Because they get a lot of headline all the time. They get a lot of
Mm.
sensationalism. What they need is content to put things in context and know what they're empowered to do about it.
And I also find that because I also have a podcast and I find I'll put episodes out and sort of make a comment on one. And I had an episode recently where I put a comment on it and I had a few people disagreeing with me. And okay, you can disagree with me, that's fine, but you clearly didn't listen to the podcast
Right.
because
Yes.
what your disagreement is out of context. And
Yes.
so I'm having to write in the context that they didn't get because they didn't even go to the timestamp that I gave them. So they didn't have to listen to the whole podcast. They could
Right.
have listened to 3 minutes
Yeah.
and had context. But instead, it was easier to just look at that one sentence and immediately disagree and dispute
And judge.
and,
Mm,
and call into question
yeah.
the validity of what I'm saying. And it's like, well, if you want to argue with me, that's fine and cool, but could we be on the same page with the argument? Could you at
Right.
least get the content first?
Yes.
And then we have something to discuss. Just telling me I'm wrong when you don't know what I said is kind
Exactly.
of,
Come
you
on,
know,
folks. Come
you,
on. Yeah. No,
you got to
this
give
this
me
is
a chance here, right?
no, no, but they're not giving themselves a chance. They're not
Right.
giving themselves a chance to hear, a deeper. I'm not going to use the word right, a different perspective. All right, and it's like
Mm,
if we actually just actually spoke with each other, we'd actually find there's so much more in common, and there's so much more we agree on, but we're just using different verbiage or different angles to look at it. And because
right.
we're so busy being sensationalized, and this has a lot to do with the way politics has happened since 2016, of sensationalism and stirring people up and
Mhm.
hysteria. And what happens when people are in hysteria? They step into fear. What happens when they step into fear? They step into anger. They step into bring pitchforks out. And,
Right.
there is no rationale in that state of presence. And so, if people kind of just calm down, breathe. All right. Now let's start having a conversation this way, deeper than the sensationalism over here. And that is up to each and every one of us of what we're feeding, because what we feed grows. And if you feel that sensationalism like junk food is feeding you, I'm afraid you're a little misunderstood. So you need
Right.
some healthy substance in your diet, which is also means healthy information.
Yes, and at least looking at it,
Yes,
really have a look at where did it come from.
exactly.
I love to give people who are interested even a little bit some tips on how to do your research.
Yeah.
And by research, I mean looking at other people's research. I don't mean you're going to set up a lab,
Yes.
but there is googlescholar.com in the US at least that is free. You can get all kinds of peer-reviewed research articles there. And the key to that is you put your keywords in, the thing you're looking for, in the search bar. You get a bunch of articles come up. Anything that looks likely to you, it looks like it has your subject, read the introduction first, the abstract, right?
Mhm.
Read the abstract first. If the abstract is speaking about what you're interested in, go to the conclusion. Who paid for it?
Right.
Who paid for the research? Does the conclusion make sense? Like as in, is it written in English
Yeah.
or is it a whole bunch of mathematical equations that you can't do anything
Right.
with?
Gobbledygook. Yeah.
So if your abstract and your conclusion are good and you're happy with who's paid for it, now you can read the article. Otherwise, you save yourself a ton of time and lots of pages. And, I've got 4 degrees. I've done a lot of this
Yeah.
reading in my time. So you have to find a way to cut that down and just read the key stuff that's going to direct you to where you want to go. And the abstract, the conclusion, and who paid for it tells you everything. Because if you want to know if milk is good for you, and by the way, it isn't, it causes osteoporosis.
Mm,
But if you want to know if milk is good for you, don't look at an article paid for by the Dairy Marketing Board,
exactly.
because the results are really predictable. And
Hmm.
scientists have to earn money the same as anybody else.
Hmm.
So, if they're being paid to produce this response, this result, all they have to do is change the question until it gives them that answer,
Right.
right?
Yeah.
So, science isn't always a case of, here's my question, now I'm going to research it and I'll give you whatever answer I find. No. Do you find PhD students that failed their research? No, because when they don't get the result they're looking for, they change the question.
Right.
That's how it works. And that's not sort of dissing anybody for it. That's simply, if you know that, then you know how to look at research. And it's with a curious eye, who paid for it.
Inquisitive, wonderment, eventurism,
And how
it's,
many people? How
yeah,
many people was this tested on?
yeah.
Because sometimes it's a very, very small amount. There was a famous article that came out some years back that linked autism to vaccines. Well, that has been disproven,
Hmm.
so much so that the doctor that produced that totally falsified research
Yeah.
has been struck off,
Right.
right? And he was extrapolating from, I think it was 8 people that he worked on and gave incorrect results for. So the research itself was minimal, it was faulty. He outright lied and got struck off for it. But will that go away? No.
No,
People
no,
still hang on to it and say
exactly.
vaccines cause autism.
Yes.
And,
Yes.
and for the record, I have a very big problem with somebody who would rather their child die from a disease that could be prevented than have autism.
Hmm.
Autism is just a different way of thinking.
It
It
is.
shouldn't be a death
No,
sentence.
absolutely not.
Like, I've never understood that. And I think I can't really imagine how a parent must feel if they're looking at their child and they figure, well, I'd rather you died from measles than had autism, even if they believe that research that's been
And
shown to
and
be
that,
incorrect. Wow.
that autism or Down syndrome or any of these other challenges, what you're saying is that they're broken, they're default, and so therefore you can't love them, right? And is that what does that say to you about you as a parent? And that unless your child is this way or that way, they're defective, so you can't love them. And
You know, I don't know. If you look at some of the serial killers, I haven't seen one with autism or Down syndrome yet,
no,
but it just
psychopathic and
strikes,
narcissism, yes, but yeah,
and that's generally learned, right?
yes,
So research, read
yeah.
the abstract,
But
read the
that's
conclusion.
the whole point, though, and everything that we've talked about today. I mean, fibro was 20 years ago was one of these elusive type things not understood, and it's still unraveling itself. It's still people are still trying to understand it because, it doesn't matter what points you've got under that umbrella, it affects people differently. And, the more we share about it, the more then you find somebody, oh, I've got that, you've got that. How did you do it? And somebody says, no, I don't have
Right,
that. And it's the same with EDS. It's one of those things that each one of you are going to react to it in a different way. But the more you share about it, the more that it may be to somebody, yes, that does that for me. What do you do? Right.
right,
And it helps because it helps to know there's somebody else out there that you're not alone, and although you don't wish that on anyone else, but it also helps to know that you're not going mad, that you really do feel this, and there actually may be an answer. Let's put our heads together. Let's see, what do you do? What do I do? That we could find maybe, if not a solution, but something we can do that makes things better. But I think one of the things that's really happened in society, especially I would say in the last 12, 13, 14 years is information has been completely misconstrued to the headline hysteria, and that the more you are a person that brings information to people, inquiry that especially makes them think, and also invites them to look into something themselves, has become something that has been very much played down and dismissed. And I think that is something that it was part of the political play. And we've got to look at that right now and go, what has it done for society? It's
Well, we
divided, it's broken us, it's made us hysterical, uh, uh, you know, uh,
well, we
unreasonable people.
we now live in an era where even when you can prove that something is
Yes,
wrong, people will say, "I don't care."
right. I
And
know,
they'll go with it anyway,
I know.
even if you've shown them that it's wrong.
Yeah,
Now, I don't know how you combat that because
no,
critical thinking can't touch that.
no.
Like you can't,
You can't
if it's
reason with that.
willful,
That if somebody's willing to believe a lie,
well,
even
if
though
it's
you show
willful
them the truth,
ignorance,
they're happy to be ignorant.
well, they're choosing it
They're
actively,
choosing it, and
you
and
know,
it's
but
like, and they feel it's their right to be ignorant. Well, everybody has a right to that, but the thing is, you're imposing your ignorance on other people, and it's
right.
harming everybody else because you're not just being ignorant and keeping it to yourself. You're now expanding that ignorance out to other people who've also chosen to be ignorant, and now we have an awful lot of ignorance out there that's become dangerous.
Definitely. And some of the things, I mean, I don't know if you saw that there was a school board in Florida that banned Michelangelo's David because a parent thought that it was pornography. What?
I
I mean, that's
yeah.
it just the concept, the
Well,
concept.
I
How
call
do
them
you
the
even come up with that?
handmaiden tales people. They've watched the
Right.
handmaiden tale and they think they can turn the clock back that. And it's for you ain't going to put women back in the womb. Sorry, we're out. We're here to stay and we're growing. LBGP community, mixed marriages, people of other different race, different religions, everything else. We are too far ahead of you. You can make as much noise as you want and you can try and pass as many laws as you want to the ignorant, but there are actually more intelligent people out there than that. We're just not on CNN. We're just not on Fox News.
Well, I really hope you're right there because it can get pretty scary, some of the things that get passed here. It's pretty wild.
Well,
But
let's look at.
the fact that people are even thinking that way,
I
to
know.
me, it's mind-blowing.
Yeah.
Like, really?
Well, don't you remember a few years ago in England that Enid Blyton's biggie ears, Noddy and biggie ears, was
Oh,
banned
yes.
because they were gay? They've been around for 50 years or something, and suddenly now they're gay and they're banning all the books. That is somebody's homophobia. And anybody that protests the art, the books, the anything else, they are people with the issue. They have the problem. And that's why I say that ignorance is dangerous because they're imposing their issue, their insecurity, their
Mm.
lack of on other people and trying to pass it as a law.
Yeah, it's very difficult to navigate
Hmm.
when you've got that kind of prejudice going
Yeah,
on. It's just because it defies logic. It's not logical.
nothing
It's
rational about it at all.
it's not it's not really emotional. I mean, it kind of appears that it is,
Yeah.
but the emotionality of it is very unilateral. So it's not, there's not a range there at all. And then when people say, well, I don't care if it's right or not, this is what it is, then you haven't got anything to work with.
Well,
Like it's
no,
just
because
really hard.
I call them third dimensionalists. And quite honestly, they're going to get left behind because there are more people, fourth and fifth dimensioners, that are out there with the higher level of consciousness and that are feeding that consciousness, that are raising up that frequency of conscious intelligence. And they're working on it. We just don't see them out there in mainstream. That's the reason why I do the work I do, to bring them to people, but they're not going to go to those people because those kind of people would not understand a word we're saying. They're going to go to the people that are in that awakening or are part of that conscious awakening, and they want to see that expansion. And I think we're going to see the tilt. But for me, all this war and war on books and war on art and war on anybody that's different is the few. And it does feel like the masses because they're loud and protesting, but they're
True.
the few that know the change is already happening. They can't articulate the change, they can't be a part of the change, but they know the change is happening and they're desperately trying to hold on to something that they relate to because they're unwilling to do the work to embrace the change. And they're desperate because they know that the change is already happening.
Mm. We do live in very interesting times.
We
Boy, we
do.
do.
Exasperating sometimes, but also interesting. So most
Lots
certainly
going on.
a
But
lot
I
going on.
look forward to when you're doing the book for
Yes.
nutrition. I've already contributed for the book on forgotten children, so
Yes.
I'm ready for the next one.
Oh, definitely. Yes, I'm hoping to do
That will
two
be,
books a year. And one will be a philanthropy book, which um, we're raising money, folks. Kickstart, it will be coming out very soon. So just pay attention to the orchardofwisdom.org and also onto Self-Discovery Wisdom. It will come up. And we're going to be raising money to pay for all our contributors here and pay for the book. And money that we raise from the book goes back to the organizations they support because there's so many people doing wonderful work out there and we want to support them. So each writer is actually supporting an organization that's doing the work. And then the other book there will be business coaches, there will be health coaches. They pay for that because that's a different platform, but there also will be coming out the Forgotten Seniors book. Because we are looking at so many seniors being tossed aside, put out to farmage, and they don't realize the abundance of wisdom that they're throwing away. Uh,
yes, it's such a shame that we can't look at older people as elders,
yes,
as a source of great information. You know, one of
exactly.
the things I used to love working in as a nurse in the UK was we would get some older people come in and they were just fascinating. Some of the
Yeah,
things that I learned from people because
exactly.
we would have a little more time to talk
Then,
sometimes.
yes, those days.
And some of the things that you would hear and discover about their lives and what they've
Exactly.
seen and done. And I think that is marginalized so much now that people just don't care. And that's a
I have a
pity because they're missing
young
a lot.
exactly. My daughter's flatmate works on the trains going to the Rockies. Um, and most of the people that are on that are kind of late 50s, 60s plus. And she said she's got time to serve them and listen to the stories. And she said it has broadened her mind, her heart, her soul, her spirit completely from listening to these stories. And like kind of gives her, well, I hope that I live a life that has a story that inspires somebody along the line. And that's what it's about. Inspiration begets invitation, which what we've done here today. We're inviting you to know more about EDS, about fibro, about nutrition, about life in general, right? Be inquisitive, folks. Don't just take the headlines and think you know it all. Do the research, read the content. If you've listened to the show, we know you're a person that likes depth and that you like to know more. So please, converse with other people about this show. You know, um, you don't know anybody with EDS, so you think, but start talking about it. Anybody know about this? So you never know. There may be somebody in your group that actually has it that doesn't want to say it because
Or
nobody
they might
else would.
not know.
Oh, don't know. Or they
They,
don't know. Or they're
they
too
might not know.
embarrassed to say because, again, we somebody has cancer, we're all over them to help them. But when somebody has a condition that is a lifelong thing, it's a different scenario altogether. Just because we look all right doesn't mean we are all right, right? And we don't want your pity. We just want your understanding of what we can and what we can't do. And then sometimes we just might need a little moral support. So, my darling, how do people get hold of you and reach
Email
you?
is email is a great way, which is Mikki, Mikki, at gaffenstone.com, Gaffen, stone like a rock.com. My website is gaffenstone.com, so nice and easy. Or you can find me on social media. I'm on Facebook, LinkedIn, Instagram. And if you look up Mikki Gaffenstone, I'm the only one there. So I'm
Right.
very easy to find.
And also you've got inspiredchoicesnetwork.com podcast, where
Inspired
people,
Choices Network. I have Navigating Complicated Relationships on there every week on Wednesdays at 12 noon Eastern Time or 10 a.m. Mountain Time. And that's a 55-minute podcast and TV show. And I'm always open to people giving me subjects that they'd like
Yes.
me to look at. I have done complicated relationships with food, for example. You
Hmm.
now won't be shocked to know.
You're
Uh,
right.
Parenting features a lot,
Hmm.
and relationships when you're co-parenting, for example, how to handle that when somebody else is not really very friendly about it, and so on and so forth. So
I
there
mean,
were so many.
relationships with people that have, different, that are differently able, because the relationship is going to have to be navigated differently,
Yes,
right? So,
there's
yeah.
so many. It's a
Mm,
topic that I can keep going on for a
right,
good while, I would say. So, I'm always interested to know what people are looking for, and if I can
right.
do it, I will. And if I
And of
can't, I'll
course,
find an expert that can.
yes, exactly. She's a researcher, folks. If you think that you have EDS, and again, if you go to the show page, all you have to do is put in her name, put in Mikki. It'll come up. You can see the show page there with the information leading to it. If you think you have it and maybe you can't get diagnosed right now, reach out, share the things that you have. Mikki is not afraid of you asking her questions, and she's also knows how to point you in the direction to go and get what you need to know. So, um, you know, one of the things I think that's wrong with society is that we need to apologize for anything that we are challenged with. We don't need to apologize for anything, folks, right? So it is, if you have what you have, you have what you have. Now it's how to live with it, and that's simply it.
We're all just trying to get along. So I am happy for anybody with questions to come and ask me. That's fine.
Exactly.
And I will be very honest. If I know the answer, I'll give it to you. And if I don't, I'll either find someone that does, or I'll just let you know that I don't, and I'll start looking for resources.
Right.
So, we'll figure it out.
Exactly. The figuring it out, folks. That's what it's all about. Thank you, Mikki, for being here again. I know we're going to be doing that show on nutrition, that one. Uh,
Absolutely.
and of course, there will be a show also with her to do with the book. So we're going to see a lot more of Mikki in the future. And we're very honored to have you here sharing your wisdom. So thank you very much.
Thank you so much. I really enjoy these in-depth conversations.
Me too. Until next time, folks, no matter what you have, keep your chin up. You're still a beautiful person inside and out. You're just faced with a little challenge that's got to go with you and through life, but you can do it. Until next time, bye for now.